Okay. Okay, good afternoon. Hi, my name is Cindy Iwagu, and I am in group 14. And unfortunately, I was not able to join my group for the meeting just because I had some technical difficulties. I was in a different state. But I just wanted to respond to what my group thought about the group case. So I don't really have the document in front of me, but I took notes of what my group was saying during that time. And I 100% agree with the setting was there was a patient and he was just very non-compliant and he was very aggressive. And he believed that some, I guess, outer space thing was after him, especially when they put the IVs on him, but the IVs needed to be put on him. And so he would pull it off aggressively and he was putting the nurses at harm and he was putting the doctors at harm that were around him. And so the healthcare workers wanted to come to a conclusion on what to do. The nurses were very frustrated by it because they were constantly getting hurt, and the doctors were obviously frustrated. But the family the family wanted to make sure that one, he was okay and that he was comfortable, and they didn't feel comfortable with the idea of like tying him down or anything like that. And they also didn't feel comfortable with him being on any antipsychotics so that they can calm him down. And so that's ultimately the dilemma is like, what do we do? Where is the line? At what point do we start? At what point do we focus on the patients or re-gear our focus to our healthcare workers as well and their harm that they may be put in? And so my group members, they pretty much came to the conclusion that it was important, one, for education. We believe that the parents of the patient may not realize the extent of what may be going on. We also believe that it's very important to educate the family on what's going on and how aggressive the patient has been and how harmful it could be for the nurses and the doctors that could be around him, so that they understand the gravity of what's going on and why we would like to possibly put him on an antipsychotic or put him or kind of restrain him only to protect ourselves. We also think that it would be important, because he has these episodes so infrequently, possibly at a point where he's not having an episode, maybe explain to him what's going on and try to help him understand that he is being harmful when he doesn't realize he is. And so those are some of the options that we came up with. We also said that the biggest, or one of the main things that we wanted to focus on as far as the tenets of the ethical tenets was the non-maleficence, and that's just pretty much saying that we don't want to do harm. And when we say we don't want to do harm, we mean we don't want to do harm to the patient. And ultimately, we would be putting the patient, not only ourselves at risk, but we're also putting our patient at risk. When the patient is acting so aggressively, he can possibly hurt himself as well. But we do also want to respect his autonomy, and that's why we feel like it is important to have this conversation with him when he is as lucid as possible, just so that he can at least hear us when he's in a state where he has the ability to, and also just making sure the parents are fully aware of what's going on. We don't want to do anything behind closed doors or feel like somebody is being left out of the equation. We also believe that it's important that everyone in this is a partner through while practicing or while dealing with this patient. We just want everybody to be fully informed. What else did we talk about? I mean, those are some of the biggest things that we talked about, was just the education that needs to be there. We do understand this is going to be a very tough situation. It's not a situation in which, it's not a situation that could be resolved very easily. We understand that because the patient is not always fully sane, having this conversation and getting to a place where he even understands the conversation after we have it may be difficult. But just the start of communication we feel is important. We also encourage that any ideas that the parents may have, anything they, just so that they can also feel some sense of empathy for us as the healthcare workers. If they have some suggestions on something that we can do instead, or we're more than willing to also accept any of those ideas. Yes, that's those are like some of the main things that they spoke about, and I'm 100% behind them. Oh, we also had one more alternative, because the patient was pretty much having these episodes mainly when those IVs were placed on him. We thought that maybe we can have an alternative. So as opposed to having those IV drips on him, possibly an oral medication that has the same effects. If that could be a possibility, we also wanted to explore that. We understand that there may be some issues. Maybe he may have some drug interactions that wouldn't be best, but we like to at least explore any possible alternatives, just so that we respect or we honor that he is experiencing what he experiences with these IVs on. And so that's what we kind of talked about, especially because those seem to be the main time he would have those episodes, is when those things were placed on him. So possibly if an oral medication would help in a sense, maybe an IV or maybe an injection or intramuscular administration, as opposed to the wires being placed on him. I think those are some of the main points that my group members hit. If you guys have any questions, please feel free to email me. I'm so sorry for the delay. And thank you so much. I appreciate you for your time.